Hi everybody, it's Marie again. First of all, I just wanted to give a big shout out to the people helping us with the Mental Illness Awareness Week, Laura, for sending me this awesome flip cam that I can use now to post videos on the YouTube channel for MIAW. There's just a couple things that I wanted to touch base on in regards to what my topics are to talk about today. And the first one is about cognitive behavioral therapy. Cognitive behavioral therapy is a type of therapy that I've been using a lot during the past 4 years now. And it's not through medication, it's just straight out therapy. You read on about it, you practice thought charts with your therapist, and it's a process that takes time to learn how to do. But a few things that I wanted to name as an example were when you, for example, worry about something so much that it escalates, that your worry turns into this huge beaker of water that when you drop a little bit of ink in the water, it discolors the entire beaker. It's like that with our minds. Our negative thoughts sometimes seep through our brains and ruin everything. We get anxious, we get paranoid, we get tearful, we get fearful. And those emotions come because we're not able to put a stop to the thoughts that keep going and going and going and going. And most of those thoughts are worry and paranoia. And so I was talking to someone that I'm dating who also has schizophrenia, and he said, whenever I get those thoughts, I always think of it this way. I'm in the zone with these thoughts. They're not pleasant, but I know that I've had them before. They keep coming back, and sometimes it's a bit scary if it's going to be a different feeling than before, and how am I going to deal with a different feeling if I don't know how it feels? Basically, what I'm saying is, when you're at a point in your life where you get anxious and you have that attack or you have that worry in your heart and you just can't seem to get out of it, you just have to try to remember that you have control over the situation. Put a stop to the mental filter that is causing you to catastrophize, and start maybe looking up some terms. You can even look them up online. They're called distorted ways of thinking. And it's a wonderful approach to use for people with mental health issues when we have anxiety and we have paranoia and we have a lot of emotions that can be uncontrollable that leave us in a really bad place at the end of the day. So it's called cognitive behavioral therapy. There are terms of the ways of how we think, and they're called distorted ways of thinking. And I just wanted to give a little intro about that in case people with mental health issues or people without want to take up on a look about that. So it's helped me mentally try to devise ways to put the pieces of the puzzle back whenever I get anxious, whenever I get furious, whenever I catastrophize, meaning I think this, and this will happen, but there's no evidence that it's happened. Or I'm worried something bad's going to happen tomorrow. Well, what's the worst thing that could happen? Like those kinds of questions you ask yourself to ensure that you don't get too ahead of yourself. And I think the reason why recovery is possible for my situation is because I study my thoughts. And I think, okay, if this is the case, what can I do to make my thoughts more relaxed and more fluid and less corruptive? So I hope this was helpful. I have been babbling on for about 4 minutes, but if you have any other things you would like me to talk about in regards to mental health, maybe post in the chat box below, and I'll be back again. Okay, bye.